The CDC, which is the National Center on Birth Defects and Developmental Disabilities, along with the American Academy of Pediatrics, put together this autism alarm document that you're looking at here. They're basically saying autism is prevalent. We need to listen to the parents. This is for doctors to follow. They need to act earlier than they have been in terms of diagnosing and screening. They need to refer them out to the appropriate services, and we need to continue to monitor what's going on. So to expand on this a little bit, where they're talking about autism is prevalent, as they were saying, 1 in 88 kids in the country are diagnosed with autism at this point. They're saying 1 in 6 children are identified with developmental disorders and/or a behavioral problem. And developmental disorders have subtle signs that may be easily missed. When they're talking about listen to the parents or listen to the grandparents, as we've got in here tonight, early signs of autism are often present before 18 months. Parents usually do have concerns that something is wrong. Parents generally do give accurate and quality information. When parents do not spontaneously raise concerns, ask if they have any. So here, there's been myths about whether parents have enough accurate information to give doctors, but it's found that it's true. Acting early, making screening and surveillance an important part of your practice as endorsed by the AAP. Well, in 2006, the average age of kids being diagnosed was 4.5 years old. In 2008, the average age of kids being diagnosed was 4 years old. Most of us know that the signs are there after 18 months. You know, so we're still behind in terms of getting the kids diagnosed. We're putting the pressure on the pediatricians and the neurologists now to start screening all children at 18 months, just to confirm that there's no issues going on here. And if they don't catch anything by 18, do it again at 2 years, just to make sure. Referring to autism specialists or other folks, you know, the specialists, the physical therapists, speech therapists, occupational therapists, and behavior analysis is what they're talking to about in the referral part of this. And continuing to monitor for concerns, educating parents, advocating for the families, all those things need to be happening as part of the monitoring part. Research indicates that parents are reliable sources. So we talked about this evidence-based screening tools that incorporate parent reports, and they give some examples. So some here can facilitate structured communication between parents and providers, discover what the parents' concerns are, increase parent and provider observations of the child, and increase parent awareness. Such tools can also be time and cost efficient in clinical practice settings. For children with ASDs, educational interventions are the mainstay of treatment. Such interventions may include, and I just mentioned all those earlier, behavior therapy, speech and language, occupational. These therapies target the core symptoms of ASD and aim to improve a child's functioning across environments. Here, we're talking about data on the prevalence on the trajectories that eliminate socioeconomic disparities. The goal of this study was to describe the typical longitudinal development trajectories of social and communication functioning in children with autism and determine the correlates of these trajectories. 6 typical patterns of social communication and repetitive behavior functioning were identified. Socioeconomic factors were correlated. Children with non-Hispanic, white, well-educated mothers were more likely to be high functioning, and minority children were with less educated mothers or intellectual disabilities were very unlikely to experience rapid gains. The conclusions here: children with autism have heterogeneous developmental pathways. One group of children evidence remarkable developmental change over time. Understanding what drives these outcomes is critical. However, let me just add here, the rapid growth and the prevalence of autism or related disorders among minorities who have historically had lower rates of autism diagnoses also suggests a trend of better diagnosis now. The CDC found a 91% increase in the estimated prevalence among black children from 5.5 to 10.5 per 1,000, and a 110% increase among Hispanic children from 3.7 to 7.7 per 1,000, compared with a 70% increase among white children from 7 to 11.9 per 1,000. What's interesting with that statistic, or with this, is we recently went to Puerto Rico to work on a grant opportunity. And there in Puerto Rico, the statistics are 1 in 72 for autism. So their rates are even higher. In addition, they were telling us that a lot of parents haven't taken their kids to be diagnosed because they don't want to know. There's no services for them. They don't want to know. So if you look at the fact that the statistics 1 in 72 and you've got parents that are even refusing to go get the diagnosis, then that means the rates are higher. So, thank you. So here they're saying the average target behavior include aggression. I'm sorry, let me just jump back a minute. Okay, we're in the classroom now. We're talking about where a lot of the services get provided prior to having CBA in the homes and so forth. So the classroom benefits of comprehensive training. There was another study. The interventions for children with autism based upon ABA had been repeatedly shown to be related both to educational gains and to reductions in challenging behaviors. However, to date, comprehensive training in ABA for teachers and others have been limited. Over 7 months, 11 teachers undertook 90 hours of classroom instruction. Each teacher conducted a comprehensive functional assessment and designed a behavior support plan. Here they found that target behaviors including aggression, noncompliance, and specific educational skills produced an 80% change in frequency of the occurrence in the classrooms just by doing training with the teachers. So, again, we're at 1 to 88. We need a bigger radar. Thank you.